The value of virtual care is it's broad for employers. The broader access to care is very important for employers, mainly for employers that have employees who are in rural settings, may not have a quick way to get care, and mobile employees. We've got employers that have workers that travel across state lines, and it's really important for them to know that regardless of where their employee is, that employee is going to be connected with a physician who's licensed in the state where they are, which is a requirement. And also the faster access to care. Employees are connecting with clinicians quickly, and that reduces treatment delays and can improve recovery times. Obviously, the employee satisfaction and the convenience of that care. And then, the travel time that Dr. Brubaker mentioned, travel time being saved. That's a huge convenience for the patient. The feedback is that it makes a significant difference for the patient, as Dr. Brubaker said, in large urban areas. Mm-hmm. And you may recall, the two of us worked with an employer who had a large food processing facility in rural Texas, and their employees were having to drive over 90 minutes to get to the closest clinic. And we were able to have sort of an employer customized solution that allowed the injured workers to connect with a local facilitator of the care. A lot of those employees had English as a second language. And so we were able to coordinate care with providers who spoke Spanish and other languages and translators. And that employer now has a great deal of time saved when an employee has minor injury on the job, and their productivity has improved. We also see improved compliance with state requirements. In the workers' compensation space, time is of the essence, and there are turnaround time requirements for reporting an injury, for getting the employee approved for care. It varies from state to state, but that quick access to care helps ensure that the injuries are reported and treated in time and in line with occupational health regulations, and provides faster access to critical information for the employer, like the employee's work status, the confirmation of the diagnosis so they can evaluate diagnosis relative to mechanism of injury, and any modified duty requirements. Is important to, if you've had the employee stay at work for their visit, and they've had that continued productivity or reduced downtime for their visit, knowing to get them back to modified duties so that they don't exacerbate that injury, and getting that information in a quick fashion is very critical for our employers. We're able to, through our automated hub, the employers have key information like the work activity status report. As soon as the visit's over, that report's available to qualified individuals, designated and authorized individuals with the employer location. We also have the importance of the private care setting. The patient comfort's very important, and the patients are very happy that we coordinate and make sure that the patient's in a private setting. That's particularly important for behavioral health as well. With the patients in a private setting where they're comfortable, it makes for a better behavioral health experience when they're seeing a psychologist. And for the behavioral health component, studies have shown that virtual care for behavioral health is every bit as effective as in-person care as far as the outcomes and the returning to productivity, et cetera. So it's a great match in addition to the injury care and employer services that we provide.